Vitamin D. Vitamin D is a fat-soluble vitamin that is essential for maintaining healthy bones, teeth, and muscles. It is also important for the immune system, cardiovascular function, and overall health. There are two main forms of vitamin D, vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D2 is found in some plant-based foods, while vitamin D3 is primarily produced in the skin when it is exposed to sunlight. Both forms can also be obtained through dietary supplements. Once vitamin D is in the body, it undergoes a series of chemical reactions that convert it into its active form, which is known as calcitriol. Calcitriol acts on various cells in the body, including those in the bones and intestines, to regulate calcium and phosphate metabolism. It also plays a role in modulating the immune system and reducing inflammation. Deficiency in vitamin D can lead to a number of health problems, including osteoporosis, rickets, and an increased risk of fractures. Some studies have also linked vitamin D deficiency to an increased risk of certain cancers, autoimmune diseases, and cardiovascular disease. Adequate intake of vitamin D through diet or supplements, as well as regular exposure to sunlight, is therefore important for maintaining overall health and well-being. How, when and by whom vitamin D was discovered? The discovery of vitamin D is attributed to a number of researchers who made key observations over several decades. In the early 1900s, it was observed that children who lived in northern latitudes with less sunlight exposure were more likely to develop rickets, a condition characterized by weak bones and deformities. This led to the hypothesis that sunlight played a role in preventing rickets. In the 1920s, a researcher named Edward Mellanby conducted experiments with dogs that confirmed the link between sunlight and rickets. He found that dogs fed a diet deficient in vitamin D developed rickets, but that the addition of cod liver oil, which is high in vitamin D, prevented the disease. Around the same time, researchers Elmer McCollum and Marguerite Davis at the University of Wisconsin-Madison identified that a fat-soluble substance in cod liver oil was responsible for preventing rickets. They named this substance vitamin D. In the following years, scientists continued to study vitamin D and its effects on the body. And further research revealed that vitamin D could be synthesized in the skin when exposed to ultraviolet light. In 1932, Nobel Prize-winning biochemist Adolf Windaus determined the chemical structure of vitamin D3, the form of vitamin D produced in the skin. Today, we know that vitamin D is essential for a range of bodily functions and that deficiency can lead to a variety of health problems. Vitamin D can be obtained through exposure to sunlight, consumption of certain foods, and dietary supplements. Functions of vitamin D. Vitamin D has several important functions in the body. Here are some of the key functions of vitamin D. 1. Promotes calcium absorption. One of the most well-known functions of vitamin D is to help the body absorb calcium from the diet. Calcium is essential for building and maintaining strong bones and teeth. And vitamin D plays a crucial role in ensuring that the body has enough calcium to support these functions. Calcium metabolism. 2. Helps regulate calcium and phosphate metabolism. Vitamin D also helps regulate the levels of calcium and phosphate in the blood, which is important for many bodily functions, including muscle function, nerve transmission, and blood clotting. 3. Supports immune system function. Vitamin D plays a role in modulating the immune system, which helps the body defend against infection and disease. Vitamin D may help reduce inflammation and improve immune function, particularly in individuals with autoimmune disorders. 4. Supports cardiovascular health. Vitamin D may play a role in maintaining cardiovascular health by helping to regulate blood pressure and reduce inflammation in the blood vessels. Some studies have also suggested that vitamin D deficiency may increase the risk of cardiovascular disease. 5. Helps regulate cell growth and differentiation. Vitamin D is involved in regulating the growth and differentiation of cells in various tissues throughout the body. This includes tissues such as the skin, which produces vitamin D when exposed to sunlight, and the colon, where vitamin D may play a role in preventing colon cancer. 6. Helps regulate insulin secretion. Vitamin D may also play a role in regulating insulin secretion and glucose metabolism, which can help prevent or manage type 2 diabetes. Overall, vitamin D is a vital nutrient that plays many important roles in the body. Adequate intake of vitamin D is important for maintaining bone health, supporting immune function, and reducing the risk of many chronic diseases. What are the dietary reference values for vitamin D? The dietary reference values, DRVs, for vitamin D vary depending on the age and sex of an individual, as well as other factors such as pregnancy and lactation. Here are the current DRVs for vitamin D established by the U.S. Institute of Medicine. Infants, 0 to 12 months, 400 to 1000 IU/day. Children and adolescents, 1 to 18 years, 600 to 1000 IU/day. Adults, 19 to 70 years, 600 to 800 IU/day. Adults, greater than 70 years, 800 to 1000 IU/day. Pregnant and lactating women have higher requirements for vitamin D, with DRVs of 600 to 800 IU/day and 600 to 1500 IU/day, respectively. It is important to note that these DRVs are set to ensure adequate intake for most healthy individuals, and individual needs may vary depending on factors such as sun exposure, skin color, and dietary intake. Some experts also recommend higher intakes of vitamin D, particularly for individuals who are at increased risk for deficiency or have certain health conditions. If you are unsure about your vitamin D intake, it is best to consult with a healthcare professional. Dietary sources of vitamin D. There are a few dietary sources of vitamin D, but it can be difficult to obtain enough vitamin D from food alone. Here are some foods that are good sources of vitamin D. 1. Fatty fish, such as salmon, tuna, mackerel, and sardines are among the best dietary sources of vitamin D. 2. Egg yolks. Egg yolks contain vitamin D, but the amount can vary depending on the diet of the hen that laid the egg. 3. Mushrooms. Certain types of mushrooms, such as shiitake and portobello, can provide vitamin D2 when they are exposed to UV light. 4. Fortified foods. Many foods, such as milk, cereal, and orange juice, are fortified with vitamin D. 5. It is also possible to obtain vitamin D through exposure to sunlight, as the body can produce vitamin D3 when the skin is exposed to UVB radiation. However, the amount of vitamin D produced in the skin can vary depending on factors such as skin color, time of day, season, and geographic location. For this reason, it can be challenging to obtain enough vitamin D through sunlight alone, and dietary sources and supplements may be necessary to ensure adequate intake. What is vitamin D deficiency? Vitamin D deficiency occurs when a person does not have enough vitamin D in their body to support optimal health. Vitamin D deficiency is a common health problem worldwide, affecting people of all ages and ethnicities. Some of the risk factors for vitamin D deficiency include: 1. Limited sun exposure. Vitamin D is produced in the skin in response to sunlight. So individuals who have limited exposure to sunlight may be at increased risk for deficiency. 2. Dark skin. Melanin, which gives skin its color, can reduce the skin's ability to produce vitamin D in response to sunlight. So individuals with dark skin may need more sunlight exposure to maintain adequate vitamin D levels. 3. Age. As people age, their skin becomes less efficient at producing vitamin D, and their kidneys may also be less able to convert vitamin D into its active form. 4. Obesity. Vitamin D is fat-soluble, which means that it can be stored in fat tissue. In individuals who are overweight or obese, vitamin D can become sequestered in fat tissue, making it less available to the rest of the body. 5. Diet. While vitamin D can be obtained from dietary sources, it can be difficult to obtain enough vitamin D from food alone, particularly for individuals who follow a vegan or vegetarian diet. Symptoms of vitamin D deficiency can vary depending on the severity of the deficiency, but can include: 1. Bone pain and muscle weakness. 2. Fatigue and lethargy. 3. Depression and mood changes. 4. Impaired wound healing. 5. Increased risk of infections. If left untreated, Vitamin D deficiency can lead to a number of health problems, including osteoporosis, osteomalacia, softening of the bones, and an increased risk of fractures. It is important to speak with a healthcare provider if you suspect that you may be vitamin D deficient, as they can help determine the underlying cause and recommend appropriate treatment. Why is vitamin D so important? Vitamin D is important for a number of reasons, including 1. Bone health. Vitamin D is essential for the absorption of calcium and phosphorus, two minerals that are critical for maintaining strong bones and teeth. Without sufficient vitamin D, the body cannot effectively absorb these minerals, which can lead to weak and brittle bones. 2. Immune function. Vitamin D plays an important role in regulating the immune system, helping to protect against infections and diseases. Vitamin D receptors are found on many immune cells, and vitamin D has been shown to enhance the function of these cells. 3. Muscle function. Vitamin D is important for maintaining healthy muscles, as it helps to improve muscle strength and coordination. Individuals with vitamin D deficiency may be at increased risk for falls and fractures due to weakened muscles. 4. Mood and cognitive function. Vitamin D has been shown to play a role in mood regulation, and deficiency has been linked to an increased risk of depression and other mood disorders. Vitamin D may also be important for cognitive function, with some studies suggesting that low levels of vitamin D may be associated with an increased risk of dementia and cognitive decline. 5. Cancer prevention. Some studies have suggested that vitamin D may play a role in cancer prevention, particularly for breast, colon, and prostate cancer. While more research is needed in this area, maintaining optimal vitamin D levels may be an important part of cancer prevention strategies. In summary, vitamin D is a critical nutrient that plays a key role in many aspects of health, including bone health, immune function, muscle function, mood and cognitive function, and cancer prevention. Who does vitamin D deficiency affect? Vitamin D deficiency can affect people of all ages and ethnicities, although some groups may be at higher risk than others. The following populations are at increased risk of vitamin D deficiency. 1. People with limited sun exposure. Vitamin D is produced in the skin in response to sunlight, so individuals who spend little time outdoors or who wear clothing that covers most of their skin may be at increased risk for deficiency. 2. People with dark skin. Melanin, which gives skin its color, can reduce the skin's ability to produce vitamin D in response to sunlight. So individuals with dark skin may need more sunlight exposure to maintain adequate vitamin D levels. 3. Elderly individuals. As people age, their skin becomes less efficient at producing vitamin D, and their kidneys may also be less able to convert vitamin D into its active form. 4. Obese individuals. Vitamin D is fat-soluble, which means that it can be stored in fat tissue. In individuals who are overweight or obese, vitamin D can become sequestered in fat tissue, making it less available to the rest of the body. Limited sources. 5. Individuals with limited dietary sources of vitamin D. While vitamin D can be obtained from dietary sources, it can be difficult to obtain enough vitamin D from food alone, particularly for individuals who follow a vegan or vegetarian diet. 6. Breastfed infants. Breast milk is a poor source of vitamin D, so infants who are exclusively breastfed may be at increased risk of deficiency. 7. People with malabsorption syndromes. Certain medical conditions, such as celiac disease, inflammatory bowel disease, and cystic fibrosis, can interfere with the body's ability to absorb vitamin D from food. In summary, vitamin D deficiency can affect a wide range of individuals, but some groups may be at increased risk due to limited sun exposure, skin color, age, weight status, dietary habits, breastfeeding, and underlying medical conditions. How common is vitamin D deficiency? Vitamin D deficiency is a common health problem worldwide, affecting millions of people of all ages and ethnicities. The prevalence of vitamin D deficiency varies by region, with higher rates reported in areas with limited sun exposure, such as northern latitudes, and in populations with darker skin. According to the Centers for Disease Control and Prevention, CDC, an estimated 32% of U.S. adults have insufficient levels of vitamin D, and 5% have deficient levels. The prevalence of deficiency is even higher among certain groups, such as the elderly, non-Hispanic Black individuals, and individuals with obesity. Globally, vitamin D deficiency is also a significant public health concern. A 2018 study estimated that over 1 billion people worldwide have insufficient levels of vitamin D, with rates particularly high in South Asia, the Middle East, and Africa. It's important to note that the optimal levels of vitamin D are still a topic of debate, and there is no consensus on what level of vitamin D is necessary for optimal health. However, maintaining adequate vitamin D levels may help to reduce the risk of a range of health problems, including osteoporosis, fractures, cancer, and cardiovascular disease. What are the signs and symptoms of vitamin D deficiency? Vitamin D deficiency can cause a range of symptoms, which can vary depending on the severity and duration of the deficiency. Some common signs and symptoms of vitamin D deficiency include 1. Bone pain and muscle weakness. Vitamin D is important for bone health, and deficiency can lead to weak and brittle bones, as well as muscle weakness and pain. 2. Fatigue. Some studies have linked vitamin D deficiency to increased levels of fatigue and decreased energy levels. 3. Mood changes. Vitamin D plays a role in mood regulation, and low levels have been associated with an increased risk of depression and other mood disorders. 4. Impaired wound healing. Vitamin D is important for the body's ability to heal wounds, and deficiency can impair this process. 5. Impaired immune function. Vitamin D is important for immune function, and deficiency can lead to an increased risk of infections and other immune-related disorders. 6. Hair loss. Some studies have suggested that vitamin D deficiency may be associated with hair loss, although more research is needed in this area. 7. Low levels of calcium and phosphorus. Vitamin D is necessary for the absorption of calcium and phosphorus, and deficiency can lead to low levels of these minerals in the blood. It's important to note that many of these symptoms can be caused by other health problems as well. So vitamin D deficiency should be confirmed through blood testing before a diagnosis is made. If you are experiencing any of these symptoms or are concerned about your vitamin D levels, it's best to speak with your healthcare provider. Medical conditions that can cause vitamin D deficiency. There are several medical conditions that can cause or contribute to vitamin D deficiency, including 1. Inflammatory bowel disease, IBD. Individuals with IBD, such as Crohn's disease or ulcerative colitis, may have difficulty absorbing vitamin D from food due to inflammation and damage to the lining of the intestine. 2. Celiac disease. Celiac disease is an autoimmune disorder that affects the small intestine, and can lead to malabsorption of nutrients including vitamin D. 3. Chronic kidney disease. The kidneys play a key role in converting vitamin D into its active form, and individuals with chronic kidney disease may have decreased kidney function, leading to vitamin D deficiency. 4. Liver disease. The liver plays a role in converting vitamin D into its active form, and individuals with liver disease may have impaired vitamin D metabolism and increased risk of deficiency. 5. Obesity. As mentioned earlier, vitamin D can become sequestered in fat tissue, making it less available to the rest of the body. This can be a particular concern in individuals who are overweight or obese. 6. Hyperparathyroidism. Hyperparathyroidism is a condition in which the parathyroid gland produces too much of the hormone parathyroid hormone, PTH, which can lead to decreased vitamin D levels and increased calcium loss from bones. 7. Medications. Certain medications, such as anticonvulsants, glucocorticoids, 8. and antifungal medications, can interfere with vitamin D metabolism and increase the risk of deficiency. It's important to note that these conditions may not always cause vitamin D deficiency on their own, and those individual factors such as diet, sun exposure, and genetics can also play a role. If you are concerned about your vitamin D levels or think you may be at risk for deficiency, it's best to speak with your healthcare provider. 8. Weight loss surgeries and vitamin D deficiency. Weight loss surgeries, also known as bariatric surgeries, are procedures that are designed to help individuals who are severely overweight or obese lose weight. By reducing the size of the stomach and or bypassing part of the small intestine. While these surgeries can be effective in promoting weight loss, they can also increase the risk of vitamin D deficiency. This is because the small intestine plays a key role in vitamin D absorption. And weight loss surgeries can alter the structure and function of the small intestine, reducing the body's ability to absorb vitamin D from food. Additionally, individuals who undergo weight loss surgery may experience decreased sun exposure due to changes in lifestyle habits, such as reduced physical activity and spending less time outdoors. Studies have found that vitamin D deficiency is common in individuals who have undergone weight loss surgery, with some estimates suggesting that up to 80% of patients may experience deficiency. This can lead to a range of health problems, including bone loss, muscle weakness, and an increased risk of fractures. To prevent vitamin D deficiency in individuals who have undergone weight loss surgery, it is recommended that they receive regular monitoring of their vitamin D levels and take vitamin D supplements as needed. The amount of vitamin D needed may vary depending on the individual's level of deficiency, and it's important to work with a healthcare provider to determine the appropriate dosage. It's also important for individuals who have undergone weight loss surgery to maintain a healthy diet that includes sources of vitamin D, such as fatty fish, egg yolks, and fortified foods. Sun exposure can also help the body produce vitamin D, but it's important to practice safe sun exposure habits to reduce the risk of skin damage and skin cancer. How is vitamin D deficiency diagnosed? Vitamin D deficiency is typically diagnosed through a blood test that measures the level of 25-hydroxyvitamin D, 25-OD in the bloodstream. This is the most reliable way to determine a person's vitamin D status, as it reflects the amount of vitamin D that is stored in the body. The optimal level of 25-OD is currently a matter of debate, with different organizations recommending different thresholds. In general, levels below 20 nanograms per milliliter, 50 mol/L, are considered deficient, while levels between 20 to 30 nanograms per milliliter, 50 to 75 mol/L, are considered insufficient. However, some organizations suggest that optimal levels should be higher, around 30 to 50 nanograms per milliliter, 75 to 125 mol/L. In addition to measuring 25-OD levels, healthcare providers may also consider other factors that can affect vitamin D status, such as age, skin pigmentation, geographic location, dietary intake, and medical conditions that affect vitamin D metabolism or absorption. It's important to note that vitamin D deficiency can be asymptomatic, meaning that a person may not experience any noticeable symptoms even if they are deficient. For this reason, individuals who are at risk of deficiency, such as those with limited sun exposure or certain medical conditions, may be advised to undergo regular screening for vitamin D status. Vitamin D supplementation. Vitamin D supplementation involves taking a vitamin D supplement to help ensure adequate intake of this important nutrient. Here are some important things to know about vitamin D supplementation. Types of vitamin D supplements. Vitamin D supplements are available in two forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D3 is the preferred form, as it is more effective at raising and maintaining blood levels of vitamin D. Recommended dosage. The recommended dosage of vitamin D supplements can vary depending on a person's age, sex, and health status. The U.S. Institute of Medicine recommends a daily intake of 600 to 800 IU, international units, for most adults, with higher intakes recommended for pregnant and lactating women. However, some experts recommend higher dosages, particularly for individuals who are at increased risk for vitamin D deficiency. Factors affecting dosage. Factors such as sun exposure, skin color, and dietary intake can all affect a person's vitamin D needs. Individuals who are at risk for deficiency, such as those with limited sun exposure or dark skin, may need higher dosages of vitamin D supplements to maintain optimal levels. Sources of vitamin D supplements. Vitamin D supplements are available in many forms, including tablets, capsules, and liquid drops. Some supplements also contain other nutrients, such as calcium or magnesium, which can help support bone health. Possible side effects. Vitamin D supplements are generally safe when taken in recommended dosages. However, excessive intake of vitamin D can lead to toxicity, which can cause symptoms such as nausea, vomiting, weakness, and confusion. Vitamin D toxicity is rare and is more likely to occur with extremely high dosages of vitamin D supplements. Consultation with a healthcare provider. If you are considering taking a vitamin D supplement, it is recommended to consult with a healthcare provider, particularly if you have a medical condition or are taking medications that may interact with vitamin D. A healthcare provider can help determine the appropriate dosage of vitamin D supplements for your individual needs and monitor your blood levels of vitamin D to ensure optimal health. How is vitamin D deficiency treated? Vitamin D deficiency is typically treated with vitamin D supplements, which are available in various forms such as tablets, capsules, and liquid drops. The specific dosage and duration of treatment may vary depending on the severity of the deficiency, the person's age and health status, and other factors such as the presence of underlying medical conditions. The recommended daily intake of vitamin D varies depending on age and other factors. In general, the Institute of Medicine, IOM, recommends a daily intake of 600 to 800 IU, 15 to 20 micrograms, for most adults, while some experts suggest that higher doses may be needed to correct deficiencies. Treatment for vitamin D deficiency may involve high-dose supplementation for a period of time, followed by ongoing maintenance therapy to prevent recurrence. High dose. For example, a common approach is to prescribe a high-dose supplement, such as 50,000 IU per week, for several weeks or months, followed by a lower daily dose, such as 1,000 to 2,000 IU per day, for ongoing maintenance. In addition to vitamin D supplements, lifestyle changes may also be recommended to help boost vitamin D status. This can include increasing sun exposure, in a safe and responsible manner, eating foods that are rich in vitamin D, such as fatty fish, fortified dairy products, and egg yolks, and maintaining a healthy weight. It's important for individuals with vitamin D deficiency to work closely with their healthcare provider to determine the appropriate treatment plan and to monitor their vitamin D levels over time to ensure that they remain within the optimal range. In some cases, additional testing or evaluation may be needed to identify and address any underlying causes of vitamin D deficiency. What are the possible complications of vitamin D deficiency? Vitamin D deficiency can lead to a number of health problems, ranging from mild to severe. Some of the possible complications of vitamin D deficiency include: 1. Osteomalacia. This is a condition in which the bones become soft and weak, leading to bone pain, muscle weakness, and an increased risk of fractures. 2. Osteoporosis. Vitamin D is essential for bone health, and a deficiency can increase the risk of osteoporosis, a condition characterized by weak, brittle bones that are prone to fractures. 3. Increased risk of falls and fractures. Vitamin D deficiency can lead to muscle weakness and poor balance, increasing the risk of falls and fractures, especially in older adults. 4. Increased risk of certain cancers. Some studies have suggested that vitamin D deficiency may be associated with an increased risk of certain types of cancer, including colon, breast, and prostate cancer. 5. Increased risk of autoimmune diseases. There is some evidence to suggest that vitamin D deficiency may increase the risk of autoimmune diseases, such as multiple sclerosis, rheumatoid arthritis, and type 1 diabetes. 6. Increased risk of infectious diseases. Vitamin D plays a role in the immune system, and a deficiency may increase the risk of infections, such as respiratory infections, tuberculosis, and influenza. 7. Increased risk of cardiovascular disease. Some studies have suggested that vitamin D deficiency may be associated with an increased risk of cardiovascular disease, including heart attack, stroke, and high blood pressure. Asymptomatic. It's important to note that vitamin D deficiency can be asymptomatic in some cases, and some individuals may not experience any noticeable symptoms or complications. However, if left untreated, vitamin D deficiency can have serious consequences for bone health and overall health and well-being. 8. Reports of vitamin D deficiency leading to premature death. There have been several studies that have suggested an association between vitamin D deficiency and increased risk of premature death. One study published in the Archives of Internal Medicine in 2008 followed over 13,000 adults for an average of 8.7 years, and found that those with lower levels of vitamin D in their blood had a higher risk of dying from any cause, including cardiovascular disease and cancer. Another study published in the American Journal of Public Health in 2014 analyzed data from over 32,000 adults and found that those with vitamin D deficiency had a higher risk of dying prematurely from all causes, particularly cardiovascular disease and diabetes. It is important to note that these studies suggest an association between vitamin D deficiency and increased risk of premature death, but do not prove a causal relationship. The exact mechanism by which vitamin D deficiency may contribute to premature death is not well understood and is the subject of ongoing research. However, it is known that vitamin D plays a crucial role in several physiological processes, including bone health, immune function, and regulation of cell growth and differentiation. Vitamin D deficiency has been linked to an increased risk of several chronic health conditions, including cardiovascular disease, diabetes, and certain types of cancer, which may in turn contribute to an increased risk of premature death. To reduce the risk of vitamin D deficiency and potentially reduce the risk of premature death, it is important to maintain adequate levels of vitamin D through a combination of sun exposure, dietary sources, and supplementation as needed, and to discuss any concerns with a healthcare provider. Can you ever have too much vitamin D? Yes, it is possible to have too much vitamin D, a condition known as vitamin D toxicity or hypervitaminocity. Vitamin D toxicity is rare, but it can occur when vitamin D levels in the blood become excessively high due to prolonged and excessive intake of vitamin D supplements. The Institute of Medicine, IOM, has set an upper limit for daily vitamin D intake at 4,000 IU, 100 micrograms, for most adults. Taking more than this amount can increase the risk of vitamin D toxicity, which can cause symptoms such as nausea, vomiting, poor appetite, constipation, weakness, and weight loss. In severe cases, vitamin D toxicity can cause hypercalcemia, an excessive amount of calcium in the blood, which can lead to kidney damage, heart rhythm disturbances, and other serious health problems. It is important to note that vitamin D toxicity is unlikely to occur from exposure to sunlight or from dietary sources of vitamin D. The body is able to regulate the amount of vitamin D produced from sunlight and obtained from food. And vitamin D toxicity is typically associated with high doses of vitamin D supplements. It is always recommended to talk to a healthcare provider before starting any new supplements, and to follow the recommended dosages to prevent potential adverse effects.